Hello and welcome back to our Protus Wellbeing media channel, or welcome if this is your first time visiting us. Today's tutorial is going to be on calf muscle massage, okay? So the reason for this is quite a lot of our clients and viewers online are struggling or do struggle with calf pain, and I imagine this is a global problem. Therefore, we thought it would be wise to give you guys some useful tips and techniques that you could potentially apply at home. Hope you enjoy the video. Please subscribe, like and comment. It all helps. Thank you. Bye. So I'm starting this lower leg massage, typically how I start every single massage. So we're using light superficial strokes just to get the client used to touch, to relax the muscles so that we can actually prepare the muscles for the deeper strokes that we want to be applying later on during the massage. So at the moment, whilst we're doing this, all we're doing is promoting microcirculation to the muscles that we want to be taking care of, and also just to realign the tissue available for us. At the moment, these are just some effleurage techniques. And then here we go. Now that is just a petrissage technique, kneading, which is a squeezing technique. Again, just trying to increase that local blood flow. As you can see, I'm actually quite general here and not specific to a certain particular area or muscle of the lower leg. So as you can see, just at the moment, just warming up the tissue. Now that the tissue is warm, I'm just doing some deeper effleurage strokes now using my knuckles. As you can see, my strokes are going upwards. This is because we're trying to remove that waste product towards the lymph nodes, which are found in the groin area. So again, here I'm just feeling for any areas that might be constricted or tight. After I've done a few deep strokes, I do go into a soothing effleurage and petrissage just to relax the client again. So here now I'm just going to be using some transverse kind of strokes. So I'm going across the tissue. As you can see, I've used my knee to help me there, just to stabilise the lower leg, just so we don't flick over any muscles or cause any discomfort. Again, not neglecting the Achilles tendon there. And I'm just hooking my fingers around the lower leg. I keep calling it the lower leg because we've got quite a few muscles there. So we've got gastrocnemius. Underneath gastrocnemius we have soleus, and then we actually have several more deeper muscles that help move the foot and ankle. So it's really important we do kind of try to work a bit deeper around the lower leg. Now I'm using my thumb and I'm actually going on the lateral aspect of the calf or the lower leg, so the outside. If you look at my thumbs there, they're applying the strokes now. And again, once I've done this, I'll then just finish off with a few lighter strokes of effleurage and petrissage. Here's another view I've done for you. I've speeded this up just so you're not getting bored with repetition. So as you can see, different view, just the strokes I just implemented there or applied. Enjoy. Now that the tissue is warmed up, I'm applying specific strokes at a deeper pressure. So using my thumbs here on the outside of the lower leg, as this is usually a problem area for athletes or runners and even general public. Now if you find an area that's quite tender, constricted, tight, this technique here is just some circular frictions. Now what frictions are doing are they're increasing localized circulation and also trying to break down kind of scar tissue and adhesions that have been created. Runners tend to get calf problems if you've increased the load and intensity of training, or potentially if they're using some old footwear that needs replacing. Now I'm just holding the technique, and this is a neuromuscular technique. I'm going to do a video on neuromuscular techniques in the future and for you guys to watch. So I'll just let you watch this for the time being without me speaking. Again, finish on just some lighter soothing strokes. And here's an example of me just using my elbow with some little vibrations controlled by the other hand. With the knee in the flexed position, the gastrocnemius is now shortened and relaxed, which makes it a lot easier to work under the gastroc to those deeper muscles that I was talking about. Now here, this is a form of soft tissue release, which essentially is helping stretch the muscle, which allows us to kind of increase the elasticity or restore the elasticity of the muscle. Again, I'm going to be doing a video on soft tissue release for the major muscle groups of the body. Again, it's really important you finish your massage just with some lighter petrissage and effleurage techniques just to relax the muscle. Hope you enjoyed the video. Look forward to sharing with you soon.